got a friend in you, I know you are so. You are my confidant, you are my closest friend. You are mine.
Hello viewers, you're welcome to your very interesting program, Semi and You. And today we have a very interesting topic to discuss. We are looking at what the dead has to offer the living. Very interesting topic, you say. But what are we really talking about? We're talking about post-mortem, we're talking about autopsy. And today I have with me on this show a renowned consultant forensic pathologist, Dr. Uwom Eze of the University College Hospital. You're welcome to this show, sir.
Thank you.
Like I said, we're talking about autopsy. And the first thing we want to know is, people talk about autopsy, they talk about post-mortem, and then the same thing. And then what do we really mean by that?
It's an interesting question. I think we have used these two terms in some way that they eventually mean the same thing. But if we have to take a closer look at both terms, perhaps we could explain them better. Now, post-mortem is actually a combination of two words, post and mortem. Now, post is what takes place after, just like you have post-jam, after jam. Now, mortem is an English word derived from a foreign word meaning death. So, post-mortem is after death. Now, post-mortem examination is the examination you do after death, and you could expand it to say investigation carried out after death. Now, that involves a lot of processes, and let me just stop at that. But autopsy, that term autopsy is actually, again, a word derived from a foreign word, which means see for yourself, by yourself, with your own eyes. Now, what it implies is that you're actually carrying out very specific procedures on the dead body. And so, when we say post-mortem and autopsy, we may essentially be saying the same thing, but in terms of scope, post-mortem embraces even autopsy and some other processes that will take place in the investigation of death. But autopsy is basically procedures that are carried out on the death in order to find out the cause and circumstances of death. So I can just say that in the usage we adopt presently, you could say that post-mortem and autopsy functionally they mean the same thing.
Okay, thank you very much. Well, we're talking about post-mortem. We're talking about an investigation after death. What do we need to investigate then? I mean, the body is dead. So why do we need to now start opening up dead issues?
Yeah, I think this is one of the questions I get relations of the disease ask me, when they come to my office and say, but doctor, why do we have to do autopsy? Why do we have to do a post-mortem? The interesting thing is that we can't possibly say for sure that we know what has caused death in some circumstances without autopsy or post-mortem examination. And it's like an audit tool. How can you possibly make any improvement in the health of the people, in your health indices, or even in the facilities that you're using for health, when you don't know what is really causing death? Now, things may appear to be what they seem to be, but there are certain things beneath the surface that only a post-mortem examination can show you. And let me tell you that from the ages, society, has always shown interest in why people die. The reason is this: if we don't know why people die, we may actually be missing out on some things that may have public health importance on the people. So we need to do post-mortem because certain things that may be hidden at the time the person was alive may actually be discovered at post-mortem. Like I said, see for yourself, by yourself with your own eyes. That's the essence of post-mortem. And we are only talking about just one benefit, public health importance.
Talking about having post-mortem done, do you have to do post-mortem on every day?
No. We don't do autopsies on every day. But we need to examine every day to know whether there is need to do autopsies. And there are every state in Nigeria, for example, has coroner's laws that stipulate what kind of death that we must do autopsy.
Yeah, I was just going to come to that to ask you. I mean, this autopsy we're talking about, is it backed up by the law? And does it apply to every part of the country?
Yes, it does. I mean, like I've just mentioned, coroner's laws. They are in most states of the Federation, but they're very effective in the southern part of the country. And the reason is that there are certain deaths, for example, sudden unexpected death, deaths from accidents, suspicious deaths, all forms of violent deaths generally, and then other classes of deaths like when you have suspicion of suicide and other things are stipulated in law. And for example, where we're working, most people come into the hospital for the first time and die within 24 hours. Usually you've not gotten enough time to investigate them properly, and in that circumstance you have to do autopsy. So the question is that we don't do autopsies on all deaths, but there are specified deaths that we must by law do autopsies on. And for those that are not within the bracket as specified in the law, for example, hospital patients, there are certain deaths that we may need to understand the genesis of the disease and how the disease has progressed in the body. That usually we need the consent of the next of kin to do such autopsies, but we call them hospital postmortem, which means that somebody is authorizing it, the next of kin is authorizing it, and then the doctor is writing pathologist. Now we need to do autopsy on this. But the other category of autopsies, which are the coroner autopsies, those ones, we don't need the authorization of the next of kin because the law has already authorized that. But having said that, we have to understand that law is just meant for man, man is not meant for the law. So we have to understand the situation and certain ethical imperatives. Even though we're going to do this autopsy, we still need to tell the next of kin about what we're about to do, just to inform them. I mean, if you look at it, it's ethical, it's conscious, and so they have to be carried along to know that this procedure has to take place because it's mandated by law. But we don't need their consent to carry on such coroner autopsies. But for hospital autopsies, yes, the next of kin must give their consent.
Okay. When you talk about coroner autopsy, I believe the dead that are brought in from outside to the hospital, that means they're brought in dead. Are those the ones you actually plan coroner autopsy? Or the ones that are in the hospital and maybe they're on admission for some days and then they die? And I just want to clarify that aspect.
Okay, now, if somebody is brought in there, again, I must just quickly tell you that there are specialists who are able to look at these cases and make some decisions about what we should actually do concerning them. Now, when you say brought in there, if you have a 28-year-old man who has been attending at a cardiac clinic and whom the doctor is aware of his cardiac condition, and we already know the genesis and the progression and the cause of the cardiac disease, and probably attended clinic 2 days ago or 3 days ago, and then died at home and was brought to the hospital. Now, it's brought in there, but you see, the doctor is happy to write a certificate, because we can review the case note and say, oh, we know how it's true. But even at that, if there are circumstances surrounding this particular death, maybe from relations, nothing stops some suspicious acts being done on somebody who may die. So that is not the reason, just because somebody has a terminal cardiac condition does not mean the person has to die at a particular time. If the circumstance surrounding that particular death calls for further investigation, though we know the history of this patient, we'll still go ahead and do that particular autopsy. But there are classical cases, for example, all violent death.
We'll come back to this.
Okay.
We'll come back to this. Just want to go on a very short break, and we want to hear the views of some of you outside on the road and the street, just to let you know what we're talking about here, and to hear your own views. What do you think? Should a dead body be examined? If it's yours, how will you feel? Would you like anyone being caught? We'll look into this when we come back. But don't forget that TNU is on Facebook. You can actually join us anytime on TNU on Facebook, or you can give us a call on the number that will be scrolled on this same media immediately after this program. You can as well write us. You'll have our email address at the end of the show. Thank you.
I depend on you. I know you are so.
Postmortem, by my own layman's understanding, is the medical check that is being conducted to certify whether the person is actually dead. That's how I understand it.
Okay. Okay. Do you believe in it, sir? Having a postmortem on a dead relation?
Well, personally, when a person dies, I always believe that, and it's certified dead. I mean, he's not breathing, he's not moving. I will prefer that the person is just laid to rest. But sometimes there's been cases of people who, after a couple of hours, they are like, we call them clinically dead. They come back. So it's important that we medically confirm, because a person might have this, might stop, but he might still come back to life. That's one reason why I think we should still conduct a postmortem. Secondly, in some cultures, there could be some issues or family issues, which if a postmortem is not carried out later, there will be insinuations. How did this person die? Did he die this way? Did he die that? But the postmortem removes all doubts or speculations about how that person died.
Okay. Thank you very much, sir. But
I'm okay.
I just want to ask some few questions from you, sir.
Okay.
Sir, do you have any idea of what is meant by postmortem?
Post-mortem.
Yeah.
I think post-mortem is an examination carried out on dead body to find out the cause of death. I think that should be post-mortem.
Okay. Sir, do you believe in it, sir? Have a postmortem on a dead relation?
Yes, I believe in it and I don't believe in it. The reason for my dual answer is that, number one, the person that is gone is gone. That's the number one reason why I don't believe in it. Then number two, because of maybe something must have killed that person that we need to know, so as to, prevent against it on we that we are alive. So I think that's the reason why I asked, answer. I gave you a dual answer to that question. So I believe in it and I don't believe in it.
Okay, you can allow doctors to have postmortem on.
Yes. I can allow it because so as to prevent, it might be something that leads to the death of that person that, ignorance is, is a killer disease. So that when you know things, when you know exactly what happened, what killed the person, then you'll be able to guide against it so that it won't kill others.
Okay. Thank you very much, sir.
Thank you.
Yes, you're welcome back to this program. Remember, we're talking about autopsy, we're talking about postmortem. And like I said, I have with me a renowned pathologist. Dr. Eze, you're welcome back again. We're looking at postmortem. We said, is it backed by the law? And then we talk about the coronary cases. Are those ones that we bring from outside, the one we refer to as coronary cases, or even the ones that actually were on admission and for whatever reason died, are those coronary cases as well?
Okay. Now, if those that are brought from outside, most of them tend to fit into the field of coronary cases because usually they may not have had any contact with their doctors, they may have died from violent death, they may have died from in suspicious circumstances, the death may have been unexpected. So most of the cases that are brought from outside who either died in the hospital or died before they got to the hospital, all of them should have autopsies. But I've told you an exception. Now, for those that are in the hospital,
okay.
Now, if relations, for example, have some issues with the management of a particular case, and actually suspected that there's a problem with maybe issues of negligence, suspected alleged or suspected negligence on the part of medical people, or that some other circumstances called for further investigation of that particular death, such deaths should have autopsies on, even though they may have been on admission for a good number of times. But I told you, in our circumstance here, most cases that are admitted within 24 hours and dying within this period, we tend to do autopsies on them because we have not had time to fully investigate them. It's not like the law says. You will see in the law where it is said, if you're brought to the hospital and you die within 24 hours, you should have autopsy done.
What if I bring the patient in within 24 hours and I insist that, okay, he's dead, but don't touch him. Don't do any autopsy, even though you feel you should do it.
Okay.
So what will you do is not an instant?
Fine. Now, like I told you, whatever laws that may be operating,
Okay.
such laws must take into cognizance all the other issues, especially in medical care. Remember,
Okay.
we still have allegiance to the patient, and we still have our respect to the relation.
Yeah.
Now, if a relation rejects autopsy, there are ways of going about it. But before I go to that extent, let me just let you know that in Nigeria, we just have coroner's laws on paper, but we don't have, in most of the states, functional coroner's law, except in a state like Lagos State, where you have the state government, doing a lot to push the law and implement it. Now, if there's an objection to autopsy, actually there should be that clause for somebody to object to autopsy. The coroner should be able to decide that objection on case-by-case basis and determine is this objection valid for whatever reason it may be, for religious reason, maybe for cultural reason, whatever is the reason. But that objection cannot override the public interest to know the cause of death, because that cause of death may be important for public health. So the point I'm making is that whatever objections that may come in may have to be viewed on the merit of an autopsy. So if, for example, the doctor is happy to say, I can see from the medical history, we can see that there are no issues, we can write a death certificate. The coroner will consider, okay, let's give it a death certificate. But it should not be something that should be at the decision of the next of kin. It has to be.
I think most of the time also we have to look at the way some of the relations feel. For instance, I know of an incident where there was a road accident. Then I'm going to ask you about that road accident too. There was a road accident, road accident. Somebody actually was driving and then all of a sudden he stopped. And people came to his house, the door of the car was locked, and they had to force the car open and all that, and they brought the man out, and they said he was dead. But within a few hours, he was taken to a clinic where they actually opened him up and did a post-mortem. In that instance, can you insist, can the law insist that because this has been done, then this case is an ordinary case, in a way? And the law insists on that, even if the relation says, no, okay, just leave it. I mean, they've done whatever they've done to this guy, let's leave it up and let him just, because I don't think it's right. What do you think the law should say?
Now, if I get you very well, it appears as if when this incident happened, the body was taken to a particular place and an autopsy was carried out, and the next of kin of the relations were not aware before the autopsy took place. It appears from what I get out from your information. Now, the first thing is, like I told you, the next of kin should be contacted. Then, when somebody dies, we have to focus on the human aspect of it. Somebody has lost someone, so there's a need to contact the person. All the apparatus of government should be triggered to contacting next of kin. Then it should be explained to them that a procedure called autopsy will have to take place to discover the cause of death. Now, the example you mentioned, we have to ask ourselves, why did the person die? Was it a collision? Was it driving under the influence of some substance or alcohol? Was the person having a pre-existing medical condition like heart disease, or did the person have stroke? All these answers will not be provided except we do a postmortem. There's a compelling need in some circumstances to do a postmortem, but it must have a human face. The human face is that we have to understand the ethical issues involved, contacting next of kin, informing them.
So in other words, they're saying if there are road accidents, you cannot just take the victim or the dead body and say you want to do a post-mortem on those dead bodies. The relations must actually certify that they are even dead. They must even agree that you should even touch the body. Nothing must be done to the body. But sir, we do that.
Yeah.
We really do that.
Again, if I have to, I understand your concern. I think I'm getting your concern, and I can understand the concern of the public. But the point we're making is this: road traffic collisions may not be what they appear to be.
Okay.
Somebody may be killed, and a road traffic collision may be set up to conceal a homicide. That is frightening to the society. So the society needs to know. So what appears like a road traffic collision may not actually be. Somebody may be driving and perhaps has been poisoned, or perhaps suddenly had a cardiac event. But what I'm trying to say is this: the law also provides for the human aspect of it. We need to contact relations. We need to discuss with them. But it is not their own right to decide that the autopsy will not be done, because the overriding public interest in preventing subsequent death. Do you know that even the seatbelt you're wearing now, the way the windscreen has been constructed, some of the safety features in vehicles, they came about because of findings from post-mortem that were done in the past. Pattern of injuries show that, oh, engineering has to do something. Oh, the road was a factor in this. Oh, this was a factor. So, post-mortem is not just autopsy, like I told you. All the factors responsible will be taken into consideration, like the bad road, like the state of the vehicle, like some other things. So, the short answer to your question is yes. We need to do post-mortem. Yes, we need to contact relations and let them understand what we need to do and explain to them what the procedure entails. I think the problem is with us. I must take the blame. Those that are practicing in our specialty are not doing enough to inform the public. Or the media is not doing enough to engage them to inform the public. I'm so happy that you're bringing this up, because I believe that people now will begin to ask the right questions and understand what we are doing, behind closed doors. It's actually
what about instances where our culture actually concept? For instance, we can talk about culture, we can talk about religion. Some religions believe that once a man dies, that man within the next 24 hours must be buried. And then you're talking about post-mortem. Post-mortem may take some days, it may take some weeks, but our religion says, bury this man within 24 hours. What do you do in such instance?
Now, I can assure you that in my professional life so far, I've interacted with pathologists, and especially forensic pathologists of all faiths. Okay. There is no religion that abhors post-mortem. I can tell you, every religion seeks for the truth, seeks for the fact. The problem is that sometimes we don't act fast enough. We have to be sensitive to religion. If I have a body brought in and it's a body from somebody who is in a particular religion that there's a need to bury immediately, I know this place has to go first. That place has to be done immediately. Often it is about delay. We delay these autopsies and they get agitated. But again, the issue of people dying and we are in a hurry to bury, also it has its own medical importance. Now, most times some of these bodies don't even get to the hospital. Somebody says, oh, they are dead. Somebody says, I'm going to bury. Who certifies death? We need to have a qualified person to certify death. And that's
we have about qualified person.
Yes.
How many people are involved in autopsy? Just briefly, who are involved in autopsy?
Okay, autopsy is within the purview of pathologists. Okay, they are the ones in charge of autopsy. But of course, we work with people. We work with morticians, we work with other technicians and other technologists that all work together as a team to making sure that we do jobs. So it's the pathologists that are really the ones involved. But in coroner cases, remember, there is a coroner that issues the order for autopsy. And these autopsies are not just done because we want to do autopsy, we are happy to cut the body off. They are done because there is a coroner mandate for these autopsies to be done. So the coroner is part of the chain.
Thank you very much, Dr. Eze. I've had with me Dr. Eze on this particular interesting topic. I'm sure you've gained a lot from it today, and I'm sure that you sit back and review your thinking as well concerning this particular topic. Thank you very much again for coming.
You're welcome.
Don't forget to join me again on Timmy and You, your very interesting program. We'll be here again next week, and we'll bring you another interesting topic. Dr. Eze, I'm sure I'll bring you back to give us another interesting topic very soon.
I'll be happy to do that. Thanks.
Please join us on Timmy and You on Facebook, join us on Twitter, and at the same time follow us on Twitter, and then remember to write me anytime, any day, about any topic. Thank you. God bless you.
I've got a faith in you. I know you are so. You are my confidence. You are my closest